Our presentation, Bridging the Home Visiting Child Welfare Divide, is authored by Amy Dorsky, Alyssa Gitlow, and Kristen Ethier. Child welfare system-involved families with young children often present with complex and multifaceted needs that cannot be met by the child welfare system alone. Home visiting programs could provide these families with services and supports. However, research suggests that they are generally not connected to home visiting programs. The literature points to several factors that may contribute to the low rate of engagement in home visiting services among child welfare system-involved families with young children. First, some home visiting programs target first-time mothers with the goal of preventing maltreatment before it occurs. Some child welfare system-involved families may be dealing with problems related to mental health, substance abuse, or domestic violence that make it difficult for them to participate. Third, child welfare system-involved families may fear being re-reported to Child Protection Services. Finally, the fragmented nature of our social service systems means that child welfare agencies and home visiting programs do not naturally collaborate. One barrier to collaboration between child welfare agencies and home visiting programs is that their approach to serving families is very different. Parents can be mandated to participate in child welfare services or feel obligated to participate even when services are nominally voluntary. Moreover, child welfare systems regulate parent behavior in the name of child protection while also providing families an array of supportive services. By contrast, home visiting services are voluntary. Little attention has been paid to efforts to encourage child welfare systems and home visiting programs to work together to address the needs of families more holistically. We examined the implementation of a pilot program that was designed to connect pregnant and parenting youth in foster care with home visiting services. Additional information about the pilot project and evaluation can be found in our paper, which will be published in the March issue of Social Services Review, or in the report that is available on Chapin Hall's website. A copy of the paper was included in the materials for this session. Lesson number 1. Cross-training is critical. Home visitors and child welfare workers need training on how the other system works. Home visitors need to know about the child welfare policies that affect the families they work with and be aware of services and supports available to those families through the child welfare system. They also need to understand that child welfare system-involved families may be harder to engage, miss more visits, and experience more instability in their living arrangements than the other families with whom they work. Likewise, child welfare workers need training on home visiting services, their voluntary nature, and the importance of confidentiality. Lesson 2. Information sharing is tricky. Having some, albeit limited, information about a family's child welfare case may facilitate the delivery of home visiting services and help home visitors provide appropriate parenting supports. Conversely, child welfare workers may want to document a family's participation in home visiting services. Consequently, it's important to have policies in place that specify both the information that can or should be shared and the conditions under which sharing can take place. For example, home visitors might share the dates on which visits took place and general topics covered during those visits, but only with a family's permission. Lesson 3. Both the child welfare and home visiting systems want their clients to be good parents, but their approaches to provide support are very different. The confidential, voluntary home visiting services can be perceived as being at odds with the child welfare systems, which require reporting and in which involved families run the risk of seeming non-compliant if they opt not to participate in recommended services. The two systems need to resolve the differences in their approaches in order to provide shared, supportive services to family. Lessons 4. Home visiting programs need to be flexible in how they serve child welfare system-involved families. In the pilot, some programs were willing to deviate from services as usual, such as novel uses of creative outreach. These were not adaptations that had been planned in advance, but adjustments that were made as various challenges to engagement and service delivery arose. Lesson number 5. Child welfare system-involved families may require more intensive services and demand more of a home visitor's time. Hence, home visiting programs should consider assigning greater weight to child welfare system-involved families than to the other families they serve. Bridging the home visiting child welfare divide requires a robust, continuous quality improvement process that should be laid out in a plan that includes a process for collecting, analyzing, and presenting data to inform practice and should involve representatives from both the child welfare and home visiting systems. To the best of our knowledge, ours was the first study to examine the implementation of an evidence-based home visiting program with pregnant and parenting youth in care. The lessons we learned about, barriers to and facilitators of engagement and service delivery, suggest that as other states or counties move forward with similar efforts, they should consider using an implementation science framework to promote effective implementation of evidence-based home visiting models with child welfare system-involved families. The Family First Prevention Services Act has the potential to increase access to home visiting services among child welfare system-involved families, not only in Illinois, but also in other states. States can claim federal reimbursement for providing 3 broad categories of prevention services, including in-home parent skill-based programs. 3 home visiting models have been rated well supported by the Title IV-E Clearinghouse. The lessons we learned from the pilot can help child welfare agencies plan for the challenges they are likely to face engaging and delivering home visiting services to FFPSA eligible populations.